We have heard feedback from some members of the press that you would like an opportunity for back and forth and to have some follow-up questions. It's an excellent suggestion, so I want you to know starting Monday, we're going to have a system for you to be able to do that. I want to again thank the members of the media for going along with these changes. We are all kind of forced to do things differently, so we're doing our best. I appreciate your cooperation. I appreciate the suggestion, and on Monday, we'll have an opportunity for you to ask questions and have follow-up questions answered. Today, I'm sad to report another 2 deaths here in the state of Rhode Island as a result of the coronavirus, bringing us to a total of 14 deaths. We have 54 new cases that I'm reporting today in Rhode Island, bringing us to a total of 711 cases, and unfortunately, we have 72 people in the hospital. As I've said from the beginning, we have our eye firmly on that hospitalization number because it's a certain number. You know, we still don't have enough testing happening, so the number of tests is somewhat inaccurate. We know there are many more people than 711 who have coronavirus. We know for sure there's 72 people in the hospital, and that number is climbing very rapidly. So we know we are in a rapid spread scenario here in Rhode Island. And what that means is we have to get even more serious about the rules we have in place around social distancing, staying at home, absolutely staying at home if you're sick, obeying quarantine if you're in quarantine, and washing your hands constantly for 30 seconds at a time. These sound simple. They are life-saving, and I need us all to do better because we are in the rapid spread phase of the virus. A few announcements. Earlier this week, I had the opportunity to talk to you a little bit about the full scale of our comprehensive response to corona. There's much talk about testing and N95 masks, but the response here in Rhode Island is much, much broader, more comprehensive and aggressive than just masks and test kits. And to that point, one of the things that we're working very hard on is making sure that we have enough hospital beds for when the surge really hits. And we've seen, if you look at the experience of states that are ahead of us, for example, New York City, they run out of hospital beds and the equipment for the beds pretty quickly once the surge hits. So we are fortunate in that we have some time now over the next few weeks that we can ready ourselves for the surge. So today I'd like to, we have, as I've said, we have the Army Corps of Engineers working with the National Guard over the past couple of weeks, going all over Rhode Island, evaluating dozens of potential buildings for additional hospital beds. And today I want to share the initial locations that we have settled on. At this point, we're planning on setting up a hospital at the Rhode Island Convention Center here in downtown Providence. Also setting up a field hospital at the former Citizens Bank building in Cranston, and also the former Lowe's building in Quonset, the Lowe's building in Quonset that is now vacant. So those are 3 areas that we have identified as excellent areas for hospital beds, nursing home beds, and alternative sites. And we are working very hard to make sure that they are ready. We believe that those 3 sites alone will get us well over 1,000 additional hospital beds. And we have to also make sure that they are staffed appropriately, have all the necessary medical equipment for those additional 1,000 beds. I want you to know that work is well underway. General Callahan, who will be speaking in a few minutes, has done a masterful job making sure that we will be ready with the hospital beds. It's a Herculean effort to set up over 1,000 hospital beds in a convention center and in a former Lowe's warehouse, but we're doing it. We're well on the way, and I feel very confident that we're going to be ready. I also want to say thank you to the hospitals the existing hospitals, they are all working hard and in collaboration with us on their own surge plans. So each hospital is going to have to expand the number of people that they can take care of. So every hospital now is putting plans in place so that they can take care of 10, 20% plus additional patients and have all the necessary equipment and staffing for when the surge hits. They're doing great work under difficult circumstances, so many thanks to the clinical leaders and nurses and executives at these hospitals who are working with us to get ready. I want to make another ask of the people of Rhode Island. We're getting the beds, we're getting the medicine, we're getting the ventilators, we're getting the medical equipment. We need people. That's an area where we continue to, as we look at the models, we still need help. We still need help. So I'm asking you again, asking you, begging you, imploring you, if you are a retired nurse, doctor, physical therapist, CNA, social worker, behavioral therapist, any healthcare worker with any healthcare experience, if you're retired, if you're only working part-time right now, if you're a recent graduate and not yet employed, we need to call you up. We need you to raise your hand to help us. By the way, it's not just volunteer capacity. We'll be able to pay many of you to do this life-saving work. I need you please to go to the website riresponds.org, riresponds.org. We can't do this without you, and so I'm asking you again, hundreds of you have already signed up. If any of you haven't and you have any capacity, riresponds.org, we need you, and we need you to sign up now. A couple of other points. You have heard me day after day after day asking you to obey the orders around social distancing. And many of you are doing it, and I want to thank you because you're saving lives, your own life, your family, the lives of Rhode Islanders. Many of you are still not complying with the social distancing orders. So I want to be even clearer today. I have ordered a stay-at-home order for all of the people of Rhode Island. That means stay at home. That means work from your home. That means stay in your house. Go out quickly and occasionally, once a week, to the grocery store. Alone, not with your whole family. The same thing if you have to go to the pharmacy. If you have to work, go to work and come home, period. If you have to go to Massachusetts to work, go to work, come home, quarantine yourself in your house, and go back to work the next day. Why am I saying this? Because we still have data showing that we're not following the rules enough. Some of you have said to me, well, how do you know? Because I have the state police and local police checking in on big box retail shops, and there's still too many people there. Checking in on grocery stores, still too many people in the aisles close together, too many people in line, too many people at the deli counter close together. We also have some data that show us we're not even doing as well as some other states. There's publicly available data, public records show that Rhode Islanders are less compliant with social distancing than our neighbors in Massachusetts, and I think even than the national average. Since we started social distancing, we've cut down on our movement by about 36%. The national average is 41%. So there's publicly available data that allows states to track how far the average Rhode Islander goes in a day. And the number of miles that the average Rhode Islander is traveling in a day is greater than what we are seeing in other states. That means we're not staying home enough. So I'm asking you to do better. We need to do better. Here's why we need to do better. Right now, I don't want to scare you, but I want to level with you. I'm going to tell you right now, we don't have enough ventilators to keep everybody safe if the surge hits sooner than we think, or if the peak is higher than we think. We don't. More people will die. We don't have enough hospital beds. We don't have enough doctors and nurses to take care of people. That's just a fact. So if you are one of those people out there who's still pushing the limits, thinks, oh, this is just like the flu, I get these letters. Governor, stop telling us to knock it off. This is just the flu. This is no big deal. I'm going to go to the grocery store whenever I want to. That's not right. That's not fair. And you're going to hurt a lot of people. And you know what else you're doing? You're making it practically impossible for me to get to the business of reopening this economy. There's a lot of people suffering right now. I hear from them every day. My mom's out of work. My dad's out of work. My restaurant, I don't know if I'll ever be able to reopen again. These stories aren't funny. They're heartbreaking, totally heartbreaking. I've been asked a lot by the media about modeling. I hope to be in a position on Monday to share where we are with respect to our modeling. But I want to tell you this. The biggest variable in the model is the level of compliance with the social distancing orders. So actually, it's not about the model. It's not about some fancy model. It's about you, the people of Rhode Island, doing the right thing every moment of every day so we can get through this safely and quickly. And I have mixed feelings. Half of me is very, very proud of you all because you're enduring incredibly difficult circumstances and doing it with kindness and with patience and with persistence and resilience. But to those of you who are still pushing the limits, I need you to stop. I need you to take this seriously. I need you to keep a distance between you and other folks. I need you to limit yourself to being with 5 people. I need you to write down at the end of the day who the 5 people were that you were in contact with. And most of all, I need you to stay home. And I'm going to keep saying that, and we're going to, by the way, we're going to continue to enforce the quarantine and continue our enforcement until we get where we need to be. In a minute, Dr. Nicole Alexander-Scott will have some additional guidance as it relates to face masks. Every single day, we get more information. The scientists are learning more. We're doing our best to stay on top of this information and adjust our response accordingly. And so the doctor has additional guidance for the wearing of face masks so we can keep ourselves safe. I want to address childcare. Unfortunately, and I mean that very sincerely, unfortunately today, I have to announce that we'll be continuing to suspend childcare licenses through the month of April. It pains me to do that because as a working mother myself, I know how tough it is to have to work and not have good childcare. I have been optimistic that we would find a temporary solution, but at this point, in consultation with the Department of Health and other experts and our child care providers, we just haven't found a solution which is safe. So what I'm telling you is we're not giving up. It's possible next week I'll have another announcement. We're not giving up. We're going to work continually and creatively. But so that you can plan, I'm telling you now, child care centers are going to remain closed for the month of April. We have provided access to care.com. Care.com, they have a special RI need page for Rhode Islanders. You can go on that site and find yourself a babysitter. Some of the babysitters are even free. They're volunteers. Thank you to the volunteers. And I guess I would just ask you to continue to work with your family and work in your own close social network to try to make it through at least a few more weeks without child care centers being open. And rest assured, we're working hard every day to figure out a solution to reopen some of these child care centers soon in a way that is safe for you and your kids and your family and the community. A minute on food delivery. Earlier this week, I announced a new service. That service is called ridelivers.com. It is a food delivery service. It's so far going incredibly well. It is, however, overwhelmed. I think in one day there were over 40,000 requests for delivery of meals. So let me say this. We need that service. We particularly need it for the elderly, and we need it for people who are in quarantine. The only way that people are going to be able to stay in quarantine effectively is if we provide delivery services for food and medicine. So what I would ask of you is that if you are young and healthy, or if you have somebody in your family who can go to the grocery store for you, or a neighbor, please do that. I hope over time, I know over time we're going to ramp up the RI Delivers service and we'll be able to have more capacity, but right now we're totally overwhelmed, and there are a lot of older folks who are in their home being told that it's a 2 or 3 day wait to get their groceries. So if you're young or if you have any other way to get your food, please do that. And please, for the moment, only use ridelivers.com if it's, if it's the only way that you can get food. Do not break your quarantine to get food. If you can't find someone to get it, go on ridelivers.com, and we'll do our best to get it there quickly. I want to take a second to address businesses, particularly small businesses. Not a day goes by that I don't hear from many of you about how tough this is. And my heart goes out to every one of you, and I really wish it didn't have to be this way. You're all putting on a very brave face, which I appreciate. You're being creative, you're being collaborative, and I know we will get through this. We will. We got through 2009, we're going to get through this. Every day I try to provide a little more guidance and a little more support. Today I want to note that as of 3 o'clock this morning, the new SBA Payroll Protection Loan Program is up and running. This is part of the federal stimulus response to the coronavirus. If you are a small business in Rhode Island, and if you are struggling and need access to capital, I want you as quickly as you can today to reach out to your banker, and if you don't have a banker, reach out to any bank or any credit union, and go ahead and file your application for the SBA Payroll Protection Program. There are many guidelines. Some of the guidelines are not clear. They're coming to us from the federal government. I'm asking for patience. I just talked yesterday to Senator Reid about this. I'm talking today to Senator Whitehouse and our congressman. They are working really hard with the federal government to streamline it. But call your banker or a credit union. If you don't have either, call 521-HELP, 521-HELP. That's the Commerce line. If you need a loan, if you need access to liquidity, today do an application for that new SBA lending program. Last note, I want to make a special note about mental health. In the same way that we're going to see a rise in the number of folks in hospitals, we are already seeing a rise in the number of adults and children struggling with mental illness. And it's going to get tougher as the economy, as more people are out of work longer. We're going to see more anxiety, more depression, et cetera. So I want to again highlight 2 referral services. A referral service for adults who need access to mental health is 414-LINK. That's our BH hotline. And for kids who are struggling, you can call Kids Link, 855-543-5465. I want to emphasize these are referral services. So you shouldn't expect to call that number and have a therapist on the other end of the line, but you can explain your situation, and they will quickly as they can refer you to the best place for you to get help. Finally, I'm pleased to announce, related to that, that we've established a $5 million COVID-19 behavioral health fund at the Rhode Island Foundation. This funding is being made available by our insurance companies as a result of a state compliance review, and this money will all be dedicated to nonprofits doing mental health and behavioral health work in response to the COVID-19 crisis. That money will begin to be available on April 6th. You can go on the Rhode Island Foundation's website and apply for a grant.